Hello and welcome to my channel. In this channel, we explain various nursing concepts in a simple form for a better and easy understanding. These videos could be used by both LPN and RN students as well as nurses who are trying to refresh their basic concepts. My name is Nasmosh. So in this video, we're going to start talking about our cardiovascular disorders, and more specifically, we're going to talk about CVA, stroke. We're going to talk about heart failure as well as myocardial infarction, MI. So let's start with CVA. What is a CVA? A CVA is also known as cerebrovascular accident, a stroke, right? There are three types of stroke. There is a hemorrhagic stroke, a thrombolytic stroke, and an embolytic stroke. So what is a hemorrhagic stroke? A hemorrhagic stroke is caused by a ruptured artery or an aneurysm. A thrombolytic stroke is caused by a blood clot in the cerebral artery. And lastly, our embolytic stroke is caused by a blood clot from another part of the body. DVTs, right? They travel to the cerebral artery. What are our risk factors? Risk factors include smoking, hypertension, diabetes, AFib, hyperlipidemia, and with AFib, it is due to the heart improper contraction, it's quivering. So the quivering and improper function could cause this blood clots. Some signs and symptoms of this include visual disturbance, dizziness, slurred speech, as well as weak extremities. And with our CVA, we could either have a left hemisphere or right hemisphere stroke. And with our left hemisphere stroke, what we'll note will be our language skills, math skills, and analytics skills will be tempered with. So signs and symptoms include expressive aphasia, which is inabilities to speak and understand language, reading and writing difficulties, as well as right-sided weakness or paralysis. So with CVA, when you have a left side hemisphere stroke, it affects your right side of the body. And when you have it on the right hemisphere, it affects your left side of the body. So with our right hemisphere, we have visual and spatial awareness, So signs and symptoms will include with overestimating abilities, poor judgment and impulse control, and one-sided neglect syndrome. They ignore the left side because remember it's on the right side, so it affects the left side. They kind of ignore, it's like they don't have the left side of their body, and they have this left side weakness paralysis, okay? How I remember this is left side language, right side reckless. Some nursing care for this patient. So our nursing care for this patient will involve, we closely monitor this client's blood pressure, systolic blood pressure over 180 or diastolic blood pressure over 110 can be indicative of a presence of an ischemic stroke. Blood pressure, because the hypertension is a risk factor. We assess the patient's swallowing and gag reflex. They might end up with aphasia. These patients are prone to aspiration. And with this, before we allow this patient to eat, right? Because we don't want them having this aspiration. So how to help the patient, sometimes we'll thicken the liquids to make them easier to swallow for them. We teach the patient swallowing techniques, and this involves their head and neck is flexed forward like they do a chin tuck. That is a common question. So with patients with CVA, we encourage them to do a chin tuck, okay? We reposition this patient frequently to prevent them from having any pressure injuries, bed sores, or ulcers, right? Because they have this weakness, they might not be able to turn themselves. We teach this patient to use the scanning technique, right? Because remember with our right hemisphere patients or patients with the right hemisphere CVA, they have that negligence of their left side. So we always tell them, you need to scan the room, right? They turn their head from the unaffected side to the affected side. So if they have this right-sided issue, their unaffected side would be right side. So from right to left, scan the room before they move. So medications to treat CVA or stroke include anticoagulants, antiplatelets, thrombolytic agents, and with thrombolytic medication, they should be given between 4 to 5 hours from onset of induction or symptoms of stroke. After that, it's contraindicated. And other treatments include surgery, and they could place an angioplasty with a stent if needed. Our next disorder that we're going to talk about will be heart failure. And with heart failure, I just remember this heart failure, HF, heavy fluid. With this, we are having a fluid issue. It occurs when the heart fails to pump fluid forward, right? The fluid is backing up. And with right-sided heart failure, we could either have right-sided or left-sided. So with right-sided heart failure, we're going to note certain things. We're going to have a rush the body with fluid, the peripheral edema. Patient will have peripheral edema. There will be weight gain. We need to report any weight gain of 3 pounds per day or 5 pounds per week gain to the medical doctor. Of course, we're going to note edema. They're going to have jugular vein distension. And with abdominal growth, we're going to have ascites, hepatomegaly, and splenomegaly. That's the spleen and being bigger. They're going to be bloated. They're going to have anorexia, cyanosis, and cool legs. They're going to have nausea and vomiting, of course, because of this ascites, and as well as the edema that we talked about. And with left-sided, mostly affects our pulmonary functions, our lungs. So we're going to have pulmonary edema with this patient. It's more serious. And since it affects our ABCs. Right-sided is more of peripheral edema and left-sided is more of pulmonary edema. So which one is more worse? They're all bad, but pulmonary edema, which is our ABC, our airway is compromised, we have an issue there. And with this, the patient will have fatigue, they'll have difficulty breathing at night, you'll hear rales, they'll be restless, they'll have cyanosis, they'll be confused, right? Because our pulmonary function is affected, so that means perfusion is an issue. They'll have dyspnea, they'll have extreme weakness. And with rales, we'll have like crackles as well. With a heart failure, there's really no chest pain. And the keywords to note with worsening heart failure will be either new, sudden, worsening, ripening, or pink frothy indication is a priority with heart failure patients. So what are the treatments for heart failure? So treatment for heart failure, I've seen people who like acronyms, and with an acronym that I've seen most people use with is unload fast. So what are this? How do we treat this patient? We'll position this patient upright. Why? Open that airway. We're going to give this patient some medication. Okay, and oxygen is priority, right? Put on the oxygen, sit them upright. We'll give them nitrates, we'll give them Lasix to empty those fluids. We'll give them ACE inhibitors to help with the cardiac function. Digoxin digs deeper. We'll talk more about this medication. This patient will have fluid restrictions, right? We'll have to decrease this afterload effect because remember, our issue with heart failure is the heart is not pumping forward the afterload. So we'll have sodium decrease. Why? Because sodium is what? Is an issue with fluid retention, right? Wherever sodium goes, water follows. And we'll also always test this patient for digoxin toxicity, ABGs, that's for arterial black gases, to make sure there's effective airway perfusion, and also with our potassium because we have what? We have Lasix with this patient. Okay. So our last disorder that we're going to talk about in this video is our MI. And what is our MI? Our MI is a myocardial infarction, and this occurs when there is a coronary occlusion or a heart attack that results into muscle death. So risk factors for this include postmenopausal women, smoking, hyperlipidemia, inactivity, diabetes, stress, as well as male patients. MI pain can be described as either sudden, rushing, radiating, or heavy pressure, right? When somebody says, I feel like somebody's sitting on my chest, that's a problem, okay? Signs and symptoms of this include anxiety, chest pain, nausea, cool, clammy skin, tachycardia, pallor, as well as diaphoresis. So our labs, what are we going to note? Remember, our cardiac enzyme labs, we're going to have elevated CKMB levels, troponin I, troponin T, as well as myoglobin levels. They'll be elevated. They will have some EKG changes due to hyperkalemia. When our cells burst, the potassium goes out to the blood. So we're going to have an ST depression or elevation, or a T wave inversion, as well as abnormal Q waves. what are the medications that we use to treat these patients? We'll have our nitroglycerin, analgesics, thrombolytic medication, beta blockers, antiplatelets, as well as anticoagulants, and some complication that can result from an MI involve heart failure and cardiogenic shock. Heart failure, why? Because wherever we have an MI, that there's damage in that place and we can't get it back, right? Some signs and symptoms of cardiogenic shock include tachycardia, hypotension, decreased urinary output, decreased level of consciousness, as well as decreased peripheral pulses and chest pain. If cardiac cells are blocked from receiving oxygen for over 45 minutes, that could lead to permanent cell damage, which is necrosis, and we can't have it back. Okay, that's why when somebody is complaining, I feel like somebody is sitting on my chest, we act fast. So with ST elevation, that means there's no oxygen or hyperkalemia, and muscles may have died, muscle death. With ST depression, there could be low O2 saturation, and which means there's an ischemic action going on, and this is an indication also of hypokalemia. And with this, our antithrombolytic agents, it's always 2 to 6 hours after an MI. And some key things we need to note with MI patients is during a stress test, we stop for any ST changes. And if any patient is getting any chemical stress test, we may be asked to stop certain medications and also stimulants that can affect with this, interfere with this test. We are told to avoid cigarettes, caffeine, right? Some cardiac meds, our nitros, our betas, our also theophylline. We are told to stop it. Remember when we talked about theophylline, it causes dysrhythmias, and the patient is asked to be NPO before and after this cardiac test, our chemical stress test. How do we treat these patients? Any patient who is having an MI, we always use MONA. Our MONA is our immediate treatment. And what is MONA? MONA is morphine. We give them morphine. What does morphine do? It helps the heart to relax, decreasing that workload. Remember, we need to decrease this afterload with MI patients. We're going to give them oxygen for perfusion because we are having a perfusion issue. We're going to give them nitroglycerin. What does the nitroglycerin do? It opens up the coronary tube to provide more oxygen. Perfusion is an issue, and we give them aspirin as anticoagulator. And how do we give this? We always do oxygen first. We give them an anticoagulator, which is aspirin. We give them the nitroglycerin and morphine. It's MONA to remember it, but how we administer it is oxygen, aspirin, nitroglycerin, and morphine. Thank you for watching. Please like, share, and subscribe to my channel. See you on the next one. Bye.